We got some good segments today. First off, this one is absolutely crazy. A man accidentally dies from a surgeon taking out his liver when they were supposed to take out his spleen. It's crazy. We're going to break it down. This one, this may be the craziest segment as far as what something happened that's just totally unbelievable.
Yeah, this is a weird one.
Yeah, and so you guys may or may not have heard about this because it's really kind of been popping up on social media a lot. So this is a story about a man who died during surgery when the surgeon accidentally removed his liver. And
in America.
This is in America, and it was in Florida. Yeah.
Oh my gosh.
So I can actually talk a lot about this because this story, I think, to the layperson, I mean, that sounds crazy, right? If I told you that somebody went in for surgery to get their spleen out and actually took out their liver, that sounds shocking, right?
Yes.
Yeah. So I can shed a little bit of light on this, but there's really no there's no good ending to this. So the background on this is a 70-year-old gentleman named William Bryan, who actually is from Alabama and had some rental property in Florida. So he's down in Florida and he started having left flank pain. So basically pain on the left side, more towards the side and the back, all right? So he goes into the hospital and they do some scans on him and they said that he had a spleen abnormality. Now, I didn't say specifically what that was. It just said spleen abnormality. And they recommended he have a spleen out. Well, there's certain things that can go wrong with spleen. Like it can get lacerated pretty easy because it's kind of a big spongy organ. It can have cysts or masses or whatever. So all that sounds, fairly,
fun.
So far, it's pretty reasonable. So he didn't want to get treated. He wanted to go home. And apparently, this is according to the lawyers of the family, that the hospital coerced him into having surgery. So there's a Dr. Thomas Shaknovsky. I looked this guy up. He's a board-certified general surgeon. So, okay, so far so good. We always talk about these weird stories.
But then he's really a plastic surgeon doing, just kidding.
Yeah, right. No, but this guy's a general surgeon. He's the right type of surgeon for the job, which I was a general surgeon before I was plastics.
Okay.
So far I'm on board with this. So he took him to the OR for a laparoscopic splenectomy. So basically laparoscopic splenectomy, it's using the little camera, you make the tiny little incisions and you dissect out the spleen, and at the very end you kind of put your hand in there and scoop it out, right? So this is allegedly what happened from the operative report. Which is crazy about this story is the operative report. So when I do a surgery, I have to dictate what I did, what happened. So the patient, the diagnosis before and after the procedure, was there complications, blood loss, the indications for the procedure, and then the description, right? It's called an operative report.
Yep.
So the operative report is out on the internet, which I assume that the family got it because they can get it because it's medical records, and then they released it. So the operative report's out on the internet. So I'm reading the operative report, and this is allegedly what happened per the operative report. And I got this from what the actual surgeon wrote. So a surgeon started the procedure laparoscopically. He located the spleen. He noted that the spleen was very large, so he converted to open, meaning, all right, that happens sometimes you're doing laparoscopic surgery. You get in there, it's too challenging, and you have to actually open the patient up because it's always easier to do these things when they're open. So he opened them up. He says he dissected the spleen free to the hilum. So the hilum basically is where the blood vessels come into the spleen, right? So here's your spleen, and it's got blood vessels come to it. So the hilum's right there. And when you're doing a splenectomy, which I did a ton of them when I just do trauma surgery because people are always getting their spleens banged up, you basically grab the spleen, you pull it up, you see the blood vessels, you put a clamp across it, you cut them, spleen's out, you tie it. I could do an emergent splenectomy in probably 5 minutes. Still, this day, they're not complicated, okay?
Yeah.
Now, that's in a patient that, it can be complicated if a patient maybe has had 15 abdominal surgeries in the past. Okay. But standard splenectomy, pretty easy. So he located the spleen, he pulled it up. He noted that there was an aneurysm on the blood vessels. And so he went to ligate the splenic vessels, and suddenly massive bleeding occurred. Which is weird because the spleen vessels are not small, but they're not that big either.
Okay.
The spleen will bleed if you rupture it in a car crash, but compared to other blood vessels, splenic vessels are not huge. So he says a splenic artery aneurysm ruptured. So an aneurysm is when the artery dilates and it gets too large, and then those are at risk for bleeding. If you've heard of brain aneurysms or abdominal aneurysms, that's kind of a dangerous thing.
Right.
So apparently, according to the operative report, it ruptured. Patient went into cardiac arrest. They started, massive blood transfusion protocols, but they couldn't save him, and patient expired. And so it did say that the spleen was eventually removed and sent off for pathologic evaluation. So that's from the op report. So the pathology report comes back, and the pathology is that it's not a spleen, it's the liver.
Oh my gosh. So he didn't even touch the spleen.
Correct. On the autopsy report, the patient's spleen was still in the patient, the liver was missing, and it was noted the patient had a splenic cyst, which was probably the source for his pain. So this brings up a ton of questions, which I'm hoping to maybe shed some light on. So I guess the first question that if I was a layperson that you might ask is it possible to confuse the liver and the spleen? And so, sort of.
The liver is like so much bigger.
Correct, absolutely correct. So I want to like show you a couple pictures here. So the first one is the anatomy. Okay, so this is obviously a cartoon drawing. The big thing at the top is the liver. It's got the left lobe and the right lobe, and you see the spleen. It's kind of right underneath the left lobe of the liver, which would be basically underneath your diaphragm on the left side of your body, okay? Mm-hmm. And so you can see that the left lobe of the liver and the spleen are very close to each other. Yeah. So anatomically, it could be conceivable that you could, confuse these, because although it's always said that the liver's on the right side of the body. That's not entirely true. It kind of crosses the midline with the left lobe. What about the appearance? So let's look at the next picture, which is the appearance of these organs. So the organ on the left is a liver. Yeah. The organ on the right is a spleen. They do look similar, okay? It's not like a stomach and a liver, which the stomach looks completely different. These organs do look similar, okay? Yeah. They look a little bit, they're different, but they look similar.
So, but to like a normal person, they look similar, but they shouldn't look similar to a surgeon.
100% correct, Sarah. 100% correct. Now, does being laparoscopic make it more challenging to identify stuff? Yes, it does. When you're looking through a laparoscopic camera, you're looking almost like through a keyhole into a room. So throw up that picture, the next one, Travis. So this is basically a shot from a laparoscopic camera. And you can see, well, I mean, it may be hard for you to identify it. The spleen is that kind of big spongy thing on the right. And you see in the background, there's the liver. They do look similar, especially if a patient's had previous surgeries. Maybe there's like some scar tissue in there. It can be challenging to get exposure with laparoscopic surgery. I've always found laparoscopic surgery to, be more challenging than open. If you open something up, everything's pretty clear pretty quick. So the problem is, according to this op report, is the surgeon says that the spleen was big, and then he opened, and then he did all this work to remove the spleen. None of that makes sense. Like, I can buy that a surgeon got lost in the laparoscopic view. In fact, I have a story from my residency. When I was a resident, a fifth-year chief resident and a laparoscopic fellow went in to do a spleen, and they actually took out a kidney. Uh-oh. Like, it can happen. Now, that's completely careless. Like, there's no excuse for that. But I wasn't involved with it, but it happened at the place where I trained. Like, it can happen that you can get lost laparoscopically, see something, and because it's a darker view, it's not as clear, like you can mistake one organ for another. Once you open, that no longer applies. Right. Like, any surgeon of basically any training level can identify a liver and can identify a spleen. So this op report where it says that he's dissecting out the spleen and he sees a splenic artery aneurysm, like, in my opinion, like, this is total fabrication. Like, I don't think that you can believe anything in that op report. Because at the end of the day, if you're gonna believe that op report, you have to believe that a board-certified general surgeon can't tell the difference between the spleen in the liver inside the body, which is just inconceivable to me as a surgeon.
Yeah, I bet they're going to be investigating all of the
100%
techs that were helping him.
So I have a theory about what happened. And of course, this is just a theory based on what was said by the lawyers of the family, what's said in the op report, what the pathology says. Because didn't mention this, in the pathology, it wasn't like they took out like a portion of the liver. Like it was the whole liver. You can tell by the weight. So for example, you were talking about size. You're right. The liver is much bigger than the spleen. An average liver might weigh 2,000 grams, right? So that's like 4.4 pounds. The average spleen weighs about 150 to 200 grams. So it's like a tenth of the size.
So he took out the entire liver.
He took out
not like just a portion.
Correct.
Because like I could see maybe like him making a mistake of taking out like the smaller left lobe.
Right. And that was one of my thoughts. Before I saw the pathology report, I was like, my initial theory was that he took out the left lobe of the liver, which that would be challenging because the lobes of the liver don't easily come apart. But hey, I mean, things can happen, or maybe it's unusual. But my theory is, this is my theory on what happened, and I'm not sure that there's a better theory out there because a lot of people have been talking about this on social media. So I think that the surgeon started the procedure laparoscopically. I think he confused the left lobe of the liver for the spleen, exactly what you said. I think he started to dissect down to what he thought was the hilum of the spleen, which ended up being the hilum of the liver. And when he started dissecting out, it's a much, much, much more complex blood vessel system. In fact, I have a picture. Throw that picture up there, Travis. It doesn't have the pictures of the splenic vessels, but these are the blood vessels at the base. See that huge mass of blood vessels at the base of the liver?
Yeah.
You got like the iliac vein running through there, the portal vein, which comes from the intestines. I mean, it is just a Gordian knot of blood vessels. It's a very, very dangerous place to be. I mean, I know that from, when I've done liver surgeries back in my general surgery day. It is a super dangerous place to be. And if like you blaze in there thinking that it's just like one artery and one vein, it would be very easy to get into massive, massive bleeding. So my theory is the op report's a fabrication. He sees the left lobe of the liver. He thinks it's the spleen. He starts dissecting down. He gets into massive bleeding, and then he opens. Like, I don't think the bleeding happened when it was open. I think that it happened when it was laparoscopic. But at that point, like, it was too late. Like, you couldn't get exposure. Like, those blood vessels, I mean, you can exsanguinate through those blood vessels in minutes. Like, those are massive, massive blood vessels. So I think what happened is he got into trouble laparoscopically. He converted to open, but couldn't salvage it. And I think the guy might have panicked and just, like, how do I get out of this?
Right.
And so, with all that bleeding, I could see the liver gets dissected, free even more. And, he's got this story of, the spleen's bleeding, because he thought it was a spleen. And I guess he just took out the liver to try to pass it off as a spleen. The only crazy part about that, well, I mean, he told the family, according to the lawyers, he told the family that the spleen was, the patient had splenomegaly, which is a condition where the spleen enlarges due to basically functional problems. And you can get some massive spleens. I mean, you can. And so my theory is that maybe he pulled out the liver and tried to pass it off as a spleen because, if I pulled out a liver and showed it to the average person and said, this is a massive spleen, I mean, they probably wouldn't know any better.
Right.
I mean, you guys probably didn't know what these things really look like until we just looked at the pictures like 10 minutes ago. But the only catch to that story is when it got sent to pathology, the pathologist would know it was not a spleen.
Yeah.
But I have a theory about that maybe he told them that he didn't want to send it off as a specimen because when you take something out of the body, you're not obligated to send it to pathology. I take out stuff out of people's bodies all the time, and every time I take something out, the nurse will be like, do you want to send this? Yeah. And if it's important, I will. But for a lot of stuff, I don't, because why would I want to generate more bills for an answer I already know the answer to, right? And so maybe he told the OR, like, don't send it. It's just a spleen. We don't need to send it. But then because the patient died, maybe they send it anyway.
Yes, that's what I would think.
Because the only two explanations to this is either you have a general surgeon that absolutely confused the liver and the spleen, which is inconceivable. I mean, it's like, Trey, if I said that you didn't know the difference between a microphone and a camera, like in your business, right? I mean, nobody could believe that. Yeah. No one could believe that. So either you have a surgeon that can't identify these two structures, or there's a cover-up. That's the only two explanations.
He's what are they called? People that take organs from people?
Like organ harvesters?
Yeah. He's trying to take his liver and sell it off.
Yeah, I don't know.
It's Florida. Anything goes.
I mean, but this is like a reputable surgeon. I mean, the guy, well, I will say, so digging into the surgeon's background, I mean, and I didn't personally dig in, it was in the article I was reading. And apparently he got into a little trouble in the past when he was supposed to take out an adrenal gland and he took out part of the pancreas. Now, to be fair, those are structures that are right next to each other, and maybe he got the adrenal gland.
But everything's right next to each other inside of your body.
Yeah, you're right. I mean, you really shouldn't do that. But like, once again, it's like conceivable. Like, that's much more conceivable than I took out a liver when I thought I was taking out a spleen.
Yeah.
You know, because I mean, it happens. Sometimes stuff sticks together. It won't dissect free, and it's like you got the adrenal gland. But I think I think at least according to the news article, that he actually didn't get the adrenal gland and he only got pancreas, which that would be really bad because that means you're not really knowing where you're at in there. So, but yeah, I think based on the information that we know from the op report and from the report of the family, the report of the lawyers, there's only two explanations here. Either this is literally the worst surgeon in the entire world, like of any country, or there was a cover-up of some sort that tried to go down and it didn't work.
No. As an organ harvester.
I don't think he was an organ harvester. I don't think so. So, yeah, crazy story. So what's going to happen to this guy? I mean, that's a big question because now there's questions of like, is there going to be criminal, charges against this guy? He's already getting sued by the family, which I mean, this is a slam dunk case for the prosecution.
Is he going to do you get your license taken away for that? I would think so.
I think so. I mean, obviously, I'm not going to speak for any medical board, but like unless there's something we're totally missing, those two options I talked about, like he doesn't know the liver from the spleen or he tried to cover it up, like both of those are, in my opinion, not conceivable with continuing to practice.
Yeah.
I think. I mean, I don't know what the medical board's going to do.
Like I wouldn't want him to do a surgery on me ever.
It's crazy.
No,
and then I guess as far as like criminal, I mean, I think it's rare you see doctors get charged criminally unless there's just like gross negligence. Like remember the doctor, the plastic surgeon that the patient arrested didn't call 911? Okay.
Yeah.
That's obviously.
It's like maybe like what if he has like some type of like chronic disability that's happening to him, making him not able to practice efficiently, and then
maybe.
He's still doing surgery knowing that he has that. That would be criminal.
That could be, or if there's like substance involved.
Yeah.
I mean, it may be criminal.
But if it was just purely just like
a mistake,
like a huge mistake, then I don't think he should go to jail.
Yeah, I don't know. I don't know enough to say.
He should not be able to practice.
I think that there is that potential risk that this could become a criminal case. But of course, who knows? This is definitely a story that we're going to have to follow up on because I think more information will come out. Because what's going to end up happening is people from the OR are probably going to get subpoenaed, and then you're going to get more information of what really happened. Because, like I said, I don't believe that op report. Like that op report's a fabrication.
Yeah.
Like nothing about the op report makes sense to me.
Yeah.
I mean, it makes sense if like everything went fine, right? If actually they sent the spleen, but obviously they sent the liver. Mm-mm. So wild stuff, man. It's definitely one of the craziest stories that I'd seen. So